Greetings, everyone. I'm Eric Hong, Executive Director for Momiji Healthcare Society. Thank you for this opportunity to speak to you about COVID-19. I'm specifically speaking to residents in our seniors residence and their family. COVID-19 is a coronavirus pandemic that is impacting on Momiji as it does much of the world. While slow in initial spread over January and February, COVID-19 has since become front of mind for everyone and affects how we conduct our daily living. Having learned from dealing with SARS and H1N1 in the past, Momiji had developed a pandemic plan that has been updated and activated to guide our response to COVID-19. The Momiji Pandemic Plan seeks to balance between keeping seniors in our care safe from infection as much as possible and supporting them to live with as much normalcy as possible for as long as possible. First and foremost on our top priority is to keep tenants in our seniors residence, our volunteers and employees safe. Since January 2020, Momiji has been conscious of the seriousness of COVID-19 for older adults, especially those with compromised health status. We are also monitoring COVID-19 as a growing threat and following public health advice in maintaining, adjusting, and suspending activities. Specific actions that we have taken to date have included the following. We have enhanced cleaning of common areas throughout Momiji. We are using signage to inform about infection risk and service changes. We are promoting hand washing and self-monitoring of signs of potential infection. We are discouraging non-essential visits to Momiji and screening visitors so as to reduce infection risk. We are supporting social distancing by suspending Seniors Active Living Center programs and other activities that put groups of people in close contact with each other. We are replacing communal dining in Zero Sun Restaurant and the Wednesday Western Lunch in the auditorium with delivery of pre-ordered meals to individual tenants' apartments. We are reducing people traffic in and out of Momiji by suspending education and interest classes, suspending large-scale events like the Bazaar and the Spring Festival celebration. We are suspending operation of the hairdresser on site, and we are changing how the Momiji store operates. Also, we are suspending group physiotherapy and individual therapy sessions, and we are also discontinuing foot care appointments as well. We have to adjust the way in which we assist our residents with grocery shopping, and we are increasing staff vigilance in watching for flu-like symptoms among our residents. We are screening staff for signs of infection before they commence their workday, and we are pre-screening for flu risk before our staff make home visits to any of our clients. And our staff are increasing use of personal protection equipment as well. COVID-19 is expected to carry on as a threat to community well-being for a long time. Coping with it will be inconvenient for all concerned and requires for everyone to be understanding and accommodating as we cooperate in changing the ways in which we normally do things. Supporting each other, we will come through these trying times and be able to recover. We are taking heed of public health advice to practice social distancing so as to lessen risk of spreading infection. We are also conscious of the risk of seniors becoming isolated. So we are requesting that while families of our residents keep visiting to Momiji, but to do so at a minimum until infection risk in the community is lessened. If anyone has suggestions to offer or questions to ask about why Momiji is doing certain things, please do not hesitate to contact me at Momiji. Thank you very much.